Good afternoon, everyone. We'll be beginning momentarily. Well, good afternoon and welcome to 2021 and our first press conference of the year. Also, welcome to a slightly different format. While we will hold these updates on Fridays, our weekly updates, and generally on the Tuesday when there is no board meeting, when we usually give a very lengthy update to the board. So welcome to today's press conference, and we will have another one this coming Friday. While we are still virtual using Zoom, we have eliminated a need to gather our experts and audiovisual staff in one room. While we practice physical distancing and wore face coverings, this is a more efficient way for media and the public to hear directly from county public health experts from the safety of their private offices. Today, you will hear from Dr. Vaughn Do Reynoso, Director of the County Public Health Department, and Dr. Henning Ansord, our County Public Health Officer. And then we will open up to the media Q&A. As a reminder, this press conference is being interpreted in Spanish by Carlos Saracedo and American Sign Language, today led by Shelley Lawrence, supported by Kelly Turner from the Independent Living Resource Center. Videos of the press conference will be available shortly after the conclusion of this press conference in both English and Spanish, posted on our YouTube channel, which you can find by searching CSB TV 20 is the name of our channel. And with that, I welcome Dr. Vaughn Do Reynoso, again, Director of County Public Health, who will start, and then when she is done, she will introduce Dr. Henning Ansord, and then we will open it up to Q&A. So thanks so much. Dr. Do Reynoso, please go ahead.
Great, thank you, Gina. I'd like to give you a quick briefing about our vaccine distribution, as well as share with you our expanded testing sites, and conclude with giving you a brief update about COVID-19 trends and what we're seeing. Next. With regards to our vaccine distribution, we are in phase 1A. We are moving through tiers 1, 2, and 3 concurrently. We have received approval from CDPH on Sunday night and confirmed yesterday that our approved providers, as well as our public health department, can proceed in vaccinating all those who are eligible in tier 1, tier 2, and tier 3 concurrently. Currently, we have 42 approved vaccine sites, and so these providers are ramping up and are learning about vaccine administration, about working through their own logistics. So we anticipate that within the next few weeks, we will have tripled our the number of providers giving the vaccine in our county. In addition to our healthcare provider partners, we are also, the public health department, distributing vaccines in our pods. And we are running pods in Santa Maria, in Lompoc, as well as in Santa Barbara. As a matter of fact, we had our first pod today to vaccinate our emergency services personnel. Of the amount of vaccines that have been allocated to our county, we ran the numbers and can report that 54% of what we were allocated have been administered to the eligibles and those who wanted. So, again, that is 54%, which is on the higher end than what our governor reported yesterday, as well as many of our colleagues across the state and nation. In addition to that, we anticipate that by next week, we will ramp up our own pod capacity to be able to offer 350 to 500 vaccines daily, with culminating in about 1,000 vaccine doses per day by early February. So we are working fast and furious to make sure that our community can get the vaccine, those who are eligible and those who are wanting it. Next. With regards to phase A, I want to quickly go through the tier one, tier two, and tier three. Although, again, with the approval from our CDPH, we are moving through those three tiers concurrently. So that's not so much of an issue as previously, as early as last week. So for tier one, we were focusing on healthcare workers in acute hospitals, in acute setting, as well as relying on our pharmacy partners to do the long-term care setting and SNFs. We did our first pod today, as I mentioned, with our EMS personnel, and have sent out the invitation to our dialysis center staff. As we move through tier two and tier three, I want to have received some questions about how do community members who are eligible, who may be in tier two or tier three, access the vaccination clinics. I want to encourage you to go to our website, and that is listed at the bottom of our PowerPoint at sbcphd.org. To the healthcare professionals page, you will see a smart sheet link. You pre-register, and then our staff, our team, will send you a link for the vaccination appointment. Next. I'd like to go over and share the good news that we have expanded our testing opportunities here in our county. So, in addition to the three existing community sites in Santa Maria, Lompoc, and Goleta, we now have expanded sites in Santa Maria as well as in Isla Vista. So you can access the testing opportunities by going to our sbcphd.org, where you will find additional information on how to register, how to schedule appointment, the hours of operation. Next. So, with regards to COVID-19 trends, we currently have So we created this PowerPoint just a few hours ago, and in that time frame, the numbers have increased. And for real time updated information, again, really wanting to point our community to sbcphd.org. But we are reporting today that there are 172 hospitalized community members with 55 in the ICU. We are also reporting today that there are 7 new deaths reported, with yesterday 6 deaths. So, yesterday was the worst day that we experienced in this pandemic. We reported 456 new cases, 1,949 active cases. All these metrics are the highest level they have ever been since it started last March. Our hospitals are running out of staffed ICU beds and have started using surge beds a few days ago. As a county, our adjusted ICU capacity is now below 1%. Santa Barbara County testing positivity and case rate are now at record highs. Our testing positivity is now at 16%, so that's double the threshold for widespread transmission. Our case rate per 100,000 is at 55%, so that's nearly 7 times the threshold for widespread transmission. And when we look at when people started getting sick, it's clear that there was an increase in infections following the holidays. While the full impact of holidays will not be known for another couple of weeks, the data implies that gatherings over the holidays and travel played a significant role in the increase in new cases. We have outbreaks occurring across the county in multiple sectors. There were 28 business outbreaks and 48 congregate care setting outbreaks reported in the month of December. The business outbreaks occurred in multiple sectors, including ag, administration, retail, manufacturing, medical healthcare, cleaning services, skilled labor, restaurants, bars, grocery stores, hotels, and construction. So it what used to be less risky is now risky given the widespread infection in our county. Next. So what this means is a call to action once more. I can't stress enough that this is really a call to action to every member in our community. Please vaccinate if you're eligible when it's your turn. Please remember the 4 W's, which is wear your mask, watch your distance, stay 6 feet apart, wash your hands, and wait on gathering. Now is not the time to gather outside your household. And finally, please stay at home and only leave for the essential needs. Together, we can improve, and we need to. Thank you. Now I'd like to introduce Dr. Ansor, who will give his briefing.
Thank you, Director Dovinoso. Good afternoon. In light of our current situation, I am at a loss. I honestly don't know what to say anymore. Many people are blatantly disregarding all warnings. There's a lot of traveling, a lot of mixing and mingling, and not wearing masks or keeping a distance going on. I understand that people are tired of the pandemic. However, denial of the facts will only make things worse. There are behaviors that are most risky, for instance, traveling and gathering, especially when not wearing masks. And there are other behaviors that are safer, like walking with a friend or a household member, keeping a distance from others, and wearing masks at all times when you're not alone. At a time when the virus is spreading almost exponentially, these choices have even greater consequences. As an example, if one person spreads the virus to about 10 others, then these 10 spread again to another 10 each, which equals to 100 newly infected people. About 2 weeks later, the next generation of infected people reaches 1,000 and so forth. That's exponential growth of a virus that spreads so easily as this one. Let's face it, our COVID situation in Santa Barbara County is dire. We are now seeing the effects from Thanksgiving, and we haven't even seen the effects from Christmas yet. Now we have close to 2,000 active, still infectious persons in Santa Barbara County, compared to only just over 1,000 at Christmas at our last press conference. The hospitals are preparing to implement crisis care. Crisis care at a hospital means that a person with urgent health needs other than COVID cannot receive the appropriate care they normally could expect. As an example, if someone suffers a brain bleed and could be saved by an expert performing a procedure, this may no longer be possible or available, just because the hospitals are overbooked with COVID patients. Currently, we only have a handful of ICU beds still available. We have 172 people in the hospital for COVID. We anticipate that roughly 17 of those will require ICU care within the next few weeks or so. Routine surgeries and procedures already had to be canceled just to make room for COVID care. We had the highest death count in the pandemic in a single day yesterday. The effect from Christmas travel and gatherings will only become fully obvious in 2 to 3 weeks from now. Fortunately, we have begun to vaccinate. However, it will take weeks and months to get the vaccine to everyone who wants it. In the meantime, please understand, we need to continue with social distancing, with wearing masks, do not travel, and do not gather. This will last likely until the fall. We have to stay creative with choosing safer ways of interaction and entertainment for the time being. Again, I urge everyone, please make the right choices to keep yourself and your loved ones safe. Thank you.
Thank you, Dr. Ansorg, and also Dr. Dovernoso. So now, we'd like to open it up to questions from the media. First up is Laura Place with Santa Maria Times. Oh,
Hi, everyone. Yes,
yes, go
hi.
ahead, Laura.
Thank you. My first question is about vaccinations for either of the doctors, if they can answer this. I'm curious how many total vaccine doses the county has now received. As of yesterday and for the week before that, it looks like it was around 17,500. Can you clarify if that number has changed?
You're muted, Dr. Ansorg.
Yes, I am sorry. We ran our numbers using the state database, and the state is reflecting that we have 16,775 doses allocated to our county.
Okay, so are you saying that you checked the number again and it was lower than
Correct.
What you thought? Okay, and it was
Correct.
16,000 what? Could you repeat the number?
16,775. And so we will be correcting that number on our website.
Okay. And about half of those have been administered already, you said?
That is correct. 54% to be precise.
And then regarding ICU capacity, you mentioned that the adjusted ICU rate is now, below 1%. And looking at the community dashboard on that main summary page, it looks like now there's a graph showing adjusted and unadjusted ICU rate. So I was curious if you could explain a bit more how those rates are figured between adjusted and unadjusted, and yeah, just which one I guess bears more weight, like which one people should be looking at to determine our ICU capacity.
So it serves two purposes. When we look at how the state is rating our ICU capacity, it is adjusted. So the adjustment and the methodology is outlined in the info portion of our web page. But essentially, the state's methodology is taking the total number of ICU occupants and adjusting it for the percentage of the occupancy due to COVID-19. And that is simplistically how the state does the calculation. And again, we are listing out our very clear step-by-step way to illustrate how the state is making that adjusted calculation. And the other calculation is pure, you take the number of available ICU beds and you subtract the number of beds filled to get at the unadjusted ICU number.
Okay, and is the adjusted rate only taking into consideration adult staffed beds and not including?
That is correct. That is correct. The adjusted is adult staffed beds.
Are you able to say whether whether there are any pediatric COVID cases right now that would be using pediatric ICU beds?
I'm not sure, Dr. Ansor.
There are none to my knowledge.
Okay, thank you.
Thank you, Laura. Next up, we're going to Melissa Newman with KSBY.
Hey, I have a couple questions. First, is the Pfizer vaccine the only vaccine available in the county, or is the Moderna available as well?
The Moderna is available as well.
Okay, and have these vaccines been available to folks other than first responders and those in long-term care sites, or is that happening in later phases?
Yes, so as I mentioned earlier, given the approval from the state, we are now concurrently doing tier 1, tier 2, and tier 3. So we are including community healthcare workers, labs, dentists, and everyone that is in the tier 2 and tier 3. In addition to that, we want to make sure that any of our providers who initially were allocated vaccines to complete the tier 1, some of our providers were able to distribute them to all those who are eligible and all those who want them and still had leftovers. Then we did early give that permission for them to proceed on to tier 2 and tier 3. So collectively, as a county, both our healthcare providers and the public health department are vaccinating people in tier 1, tier 2, and tier 3 in phase 1A.
And just a follow-up question, maybe for Dr. Ansorg, he mentioned that there's been changes to crisis care at the hospitals. Yesterday in LA County, they were talking about how folks that don't have a high probability of living aren't even being transported to the hospital anymore. Can you talk a little bit about the protocols for Santa Barbara County and if that's something that is in the future for us?
Yeah, unfortunately, I see that in the future for Santa Barbara County. Be advised that Santa Barbara has been lagging behind Los Angeles in the severity of the pandemic by about 3 weeks. And we're actively discussing this with our hospital partners. That would be a very unfortunate thing, but it is being actively discussed. It's not currently in effect, though.
Okay, thank you.
Thank you, Melissa. Next, we're going to Tom Bolton with NewsHawk.
Thank you. I had a couple of questions. I'm wondering, you mentioned the number of vaccines, and I'm wondering, when does Santa Barbara County expect to get more vaccines, and do you know the amount that would likely be coming?
We get vaccine allocation on a weekly basis, and I do not know the amount right off the top of my head, but we anticipate getting additional allocations by the week.
Okay, but you don't know how many at this point.
I don't.
Okay. Another question, you mentioned the hospitals going into the surge kind of protocol. I wonder if you could just describe that a little bit more in terms of what actually occurs in the hospitals, in terms of staffing, et cetera.
Yeah, I can take that question, Mr. Bolton. A hospital has ability to repurpose staff. For instance, if you do not perform elective surgeries and procedures, you free up the staff in the operating rooms, and you can have them work in other settings. That is one very effective tool for a hospital to be able to take care of more COVID patients, for instance. Another option would be to repurpose actually rooms, especially in a situation with COVID where you need isolation units. That becomes very critical, and fortunately, our hospitals are very good at making these decisions in a timely fashion. Another important factor is the in and out of the hospital, that we're working closely with the ambulances, which kind of patients really absolutely need to be transported to the emergency room, which can be redirected to maybe an urgent care center, or and also which patients can be discharged from a hospital in a timely fashion, that the hospitals get some relief from getting overfilled. So there are many tools in place that the hospitals do, in addition to recruiting more and more staff as much as they can.
Okay, and my last question is, we're discussion of Los Angeles County. I believe they recently ordered that anybody who has traveled out of the area and is returning or is coming to the area quarantine for 10 days. And I'm wondering if that's something that's being considered or in the offing for Santa Barbara County.
Well, we have that in place. It's just unfortunately people don't adhere to it. So we have to talk to our county officials about enforcement. But per health officer order, anybody who travels and returns has to quarantine for 10 days. That's already in place.
Oh, okay. Thank you very much.
Thank you, Tom. And next up is Tracy Lair with KUIT. Tracy, can you unmute your mic?
Is that better?
Yes, there you go.
Thank you for doing this remotely. I really respect that. My question has to do with, will the variant potentially require more than 6 feet distance? And have either of you had COVID and or the vaccine?
Well, I can speak to your first question. The variant that is very much prominent in England, London and South England, is very contagious. And you make a very good point that if it were to be the more prominent strain in our area, a 6 foot distance would not suffice. The reason why this virus seems to be more infectious is really that it somehow learned to be stickier, so to speak, to the receptors at the cells that it infects, and therefore can spread much faster. Less virus gets rejected by the cell receptors. But fortunately, we have not had a lot of these variants in the area. That obviously can change, but the CDPH lab is aggressively pursuing this and checking a lot of samples to make sure that we know which strains are really common in our area. I'm very happy to report that I received my first COVID vaccine today as part of the Department Operations Center and emergency crew that was deemed necessary. And so far, I'm feeling very good.
And I was with Dr. Ansorg, and I also received a vaccine this morning as well, and can report that I'm feeling great.
And lastly, we're seeing video from places like Florida where people are in line to just have individuals get vaccinated. Do you foresee that happening here, or are we going to be going to pharmacies? How will the common person get the vaccine and when?
So the amazing thing about our community is the strength of our healthcare system. And so I mentioned earlier that we have 42 approved vaccine sites. Some of them are hospitals, some of them are urgent cares, some of them are medical practices, some of them are community healthcare centers, and some of them are pharmacies. And so we anticipate bringing these approved sites on board and to partner up with us and to ramp up the distribution of the vaccine when they are allocated to us. So I anticipate that by really keeping my fingers crossed by March, April, that we will be offering it to the community at large.
Thank you so much.
Thank you, Tracy. And practically right on time, 1 minute after 5 p.m. That concludes our question and answer session. Thank you everyone for joining us. Thank you to our public health experts. And again, just to remind everyone that the video will be posted in English and Spanish on YouTube at CSB TV 20. Thanks so much. And we will be back here again, 4:30 p.m. this coming Friday, January 8th. Thanks so much. Have a great week, everyone. Stay safe, wear your mask, and we'll see you on Friday.
Thank you.